Everybody's probably gunning for the crux of this presentation, which is what's going to change under a new Trump second term presidency. But we wanted to begin with just giving a little bit of background on the ACA for anybody who may not be familiar with it, because it's going to provide some context for what we talk about as far as legislative changes under Trump. So, again, the Affordable Care Act, legislation enacted in 2010 with an effective date of around, first reporting year was 2015. Been upheld many times by the United States Supreme Court. Several different challenges to different types of mandates under the ACA, whether it be the Medicaid expansion, which was upheld by the Supreme Court in 2012, the constitutionality of the federal and state exchanges, which was upheld in 2015, and then the throwing out of the challenge after the individual mandate was effectively eliminated when the Congress in 2019, under the first Trump presidency, essentially zeroed out the penalty amount for the individual mandate. So the ACA has essentially a very long track record of being upheld at the Supreme Court. And let's be clear, too, that this is a fairly conservative Supreme Court that has been upholding the different provisions of the ACA over this period of time. Also, another thing to note about the ACA today is that approximately 45 million Americans are enrolled in coverage under either the federal or state ACA exchanges. This is the highest on record. It represents 14 million more people than were enrolled in 2021, a massive increase, and 32 more million people than enrolled in 2014, right? So the ACA exchanges have been increasingly popular with Americans over the course of the rollout of the ACA since 2015. It's just been a massive push, right? When you think about 45 million Americans getting their healthcare coverage through the ACA, it's significant, right? There's still a large gap, right? This gap was bigger prior to the ACA, but the uninsured gap has shrunk over time based upon the rollout of the ACA. So it's also been effective in what it was intended to do, right? Which was to decrease the amount of uninsured Americans in the marketplace and put less stress on the healthcare system as far as these uninsured Americans only showing up to ERs in emergency situations. And then states that have expanded Medicaid under the ACA, right? So, it's a very interesting map here. Obviously, the states that have been most resistant to Medicaid expansion have been the southern states. But even a majority of the southern, or many of the southern states, if you will, have expanded Medicaid. There's really only a handful of holdouts. There's 9 states left that have not gone through the Medicaid expansion under the ACA. So that has also been incredibly popular, even within some fairly conservative states like Louisiana, Arkansas, Oklahoma, Kentucky. It's expanded. And then the effect of the ACA on state expansion, right? From the adoption of the ACA, every state has experienced a reduction in its uninsured rate. This percentage points really matter here. And one of the things that I want to point out is that, with the lack of Medicaid expansion, some of these southern states haven't experienced the reduction that they would expect. But one of those Medicaid expansion states, for example, Louisiana, which is a fairly conservative state, has seen a massive reduction, right? So overall, every state has seen a reduction in their uninsured rate But we've seen it the most in the states that have fully embraced ACA expansion. And again, this goes to kind of the primary driver and purpose of the Affordable Care Act when it was initially proposed and implemented, which is to drive down the uninsured rates across the country. So one of the things that we're going to be looking at, and I think any new presidency is going to be looking at, is the effect that the ACA has had and what any changes to it might cause to something like the uninsured rate. All right. Again, the uninsured rate overall has dropped by about 50% through the from the initial expansion of the ACA. This is also an interesting map, and it's one that my colleague Nasser here found for us. Now, it's early on in the ACA here. This is a map from 2017. And we weren't able to find something that had newer numbers in it, but it does show you a very kind of interesting look at the ACA marketplace expansion. And it shows that over 50% of ACA marketplace enrollees, whether through federal and state exchanges, were in what were in 2017 Republican-controlled districts, right? So a huge number, in fact, a majority of individuals that are getting their health care through the ACA exchanges, at least as of 2017, were in Republican-controlled districts. And while we don't have a newer figure here, my guess is this map would look very similar today, if not even redder today, than it did in 2017. The reality is that many states that lean Democratic have much more in place as far as employer-sponsored coverage, whereas in some of these more red states, you're leaning on a lot of these ACA exchanges for small and mid-sized employers in order to provide coverage to individuals in the marketplace.
Just trying to curtail the ACA, his ultimate effort to entirely repeal the ACA, which was one of the original campaign promises, failed. And I think a lot of that has to do with the fact that now that the ACA has been rolled out and so many individuals are tied to the sort of the exchanges and that healthcare marketplace, it has become very difficult to sort of politically remove kind of the reliance on the ACA there. So even though that was his promise during his first term, he wasn't able to do it. During his first term, go ahead, Max.
No, I was going to remind people too that, you know, as a reminder, when Trump began his first term, he had the same trifecta, right? They controlled the House, they controlled the Senate, and they controlled the presidency. And at that point in time, they still weren't able to repeal it in 2016 at a time when there were far fewer individuals enrolled in the healthcare exchanges than there are today.
Yeah, that's right. And we're going to go ahead and talk about what that means, because one of his proposals during his first term also was to potentially introduce big block grants to states instead of what the ACA currently looks like, and allow states essentially to determine what their coverage and insurance scheme is going to, or healthcare insurance scheme is going to look like. So if there was sort of movement, it would potentially be putting more power back into the states' hands in terms of how they interact with the ACA. And Maxfield and I will discuss that that's going to, even be a bigger compliance nightmare for multi-state employers particularly. So we'll move on to that. So what happened as a result of this? Well, in a short-term effect, signups did fall, right? They went from 12.7 million to 11.4 in 2020. So there was sort of a short-term fall in terms of signups for ACA coverage. But as we'll talk about, this is a pretty brief lull into what has become now a lot more ACA signups since then. Importantly, states began to implement their own ACA laws and regulations. Notably, California, New Jersey, Rhode Island, and Washington, D.C. stepped in to have their own individual mandates and other reporting laws, which we'll discuss more in the future. So one of the things we're going to talk about is even if this ACA is going to be curtailed at the federal level, we've seen before that on a state level, the states have sort of stepped in to fill that void.
Yeah, and one of the things that I want to note from that slide, these are the 4 states that actually implemented an individual mandate. When we were monitoring this during this period, there were over a dozen states that had proposed legislation in reaction to Trump zeroing out the individual mandate penalty at the federal level. So it's something to note that there is going to be a state reaction to any changes that Trump does try to make to the Affordable Care Act, whether it be to the employer mandate or to any other provisions of it. As Nasser already mentioned, the reality here is that Trump's initial actions in his first term actually created more complexity for multi-state employers, because many of them now had to think about whether or not they have to file at a state level in addition to a federal level. And any action he could take in his second term is likely to have the same effect.
Thanks. And briefly, we'll talk about what happened during the Biden presidency, most recently on the ACA, right? So one of the big things was that he increased federal subsidies to the ACA via the American Rescue Plan and the Inflation Reduction Act. He basically passed through big federal subsidies that are set to expire in 2025. That's potentially one of the things that could happen during the Trump presidencies, is that he will allow the Republican Congress will allow this to expire, which would ultimately lead to increased healthcare insurance premiums for a lot of individuals. But that was a huge amount of federal money that was spent towards the ACA in terms of reducing the amount of premiums individuals would pay. Particularly, also it adjusted who was eligible for premium tax credits by the threshold for the federal poverty line was adjusted. Essentially, over 400% were allowed some premium tax credits in between the original thresholds. Those are also modified. So these federal subsidies are really important during the Biden presidency to keep the ACA going. And in terms of those short-term healthcare plans that we discussed earlier that Trump passed during his presidency via executive order, Biden essentially rolled those back, essentially saying that these types of healthcare plans that can discriminate based on pre-existing conditions and don't offer coverage in a lot of specific situations, shouldn't be really offered in the marketplace. So that was some 2 huge points from the Biden presidency on the ACA. And during this time, it's not included also some of more spending in terms of advertising and outreach, and ACA enrollment also increased. And during the Biden presidency, ACA enrollment also effectively increased. Now that Trump has been elected, what are his plans, right? What has he said that he was going to do with Obamacare or the ACA? Now, this is a much different rhetoric than we've seen during his last rise to the presidency, where in his first run-up, he was very vocal about repealing Obamacare. He's since distanced himself from that stance. A spokesperson for him told the New York Times directly that's not part of his campaign platform anymore. He essentially said that he's going to make ACA better, but has not really provided concrete details as of yet. If anyone knows, the famous quote, concepts of a plan that he said he had concepts of a plan that sort of is in relation to the Affordable Care Act, right, in the debate. So we haven't really gotten any sort of concrete details on what he's going to do to sort of make the ACA better. But, as I talked before, he suggested in his previous presidency that he would give block grants, which would give the states more flexibility on how they want to comply with it or how they want to carry out the ACA. But in terms of his rhetoric, in terms of his platform, he has not made the same campaign promises to repeal the ACA like he did in his first term. Which kind of ultimately leads us to our next point, so why the ACA is here to stay. At this point in time, there's record enrollment in these healthcare plans due to the ACA, as we talked about earlier. It's really entrenched at this point into the healthcare system, and has high favorability ratings amongst adults, right? So 60% of adults have a favorable view of the ACA. And as we'll discuss later on, even if there was some type of repeal, the reduction of the ACA, the complexity would only increase as states would pass their own ACA laws and requirements.
We're going to just move now into the state ACA reporting regime. And this is kind of just tailing on what Nasser was just talking about as far as added complexity and requirements. I think I agree with Nasser. I think the likelihood of Trump touching the ACA, especially during the first 2 years of his term, is probably very low. One, his rhetoric is not there as far as that being a calling point for him. Most of his rhetoric right now is around the areas of immigration and other kind of flashpoints. And I think that's where most of the activity is going to be. I think the likelihood of them introducing and or even being able to pass a bill that modifies the ACA during the first 2 years is incredibly low. But one of the things that is likely to happen if they do make it a priority and do pass something is that it's going to increase the complexity of the ACA at the state level, because there's going to be a reaction from states, just like there was the first time around when he tried to make changes to the ACA and when they zeroed out the individual mandate. And if they make even bigger changes, I mean, zeroing out the individual mandate was a rather mundane, kind of benign issue, right? Because the overall compliance regime associated with the ACA has really always focused on the employer mandate, right? And so him zeroing out the individual mandate caused a reaction from at least a dozen states, four of which implemented laws and regulations associated with it. It's likely to be even greater if it actually affects something that is even more important to states, right? And so, for example, in reaction to zeroing out the individual mandate in his first term, California implemented an employer reporting requirement and their own individual mandate associated with having healthcare coverage, right? So now all employers sponsoring healthcare coverage in California need to comply with this new state level mandate, which is a separate filing that all California employers have to go through, which affects all kind of multi-state employers that have a presence in California as well. Again, it follows in line with the ACA. So while it's added complexity, at the very least, the forms are similar and the electronic filing system is similar, but it does add to that layer of complexity for individual states. There are also penalties attached to non-filing in California for employers. So there's actually a risk here associated with a financial penalty associated with your non-filing. New Jersey also enacted, again, they allow you to use the same 1095-C forms that you furnished your employees and file with the IRS. But again, it's this extra state level requirement for employers in New Jersey that came out of Trump's initial push to try to affect or repeal portions of the ACA. And so it's really just showing that like there's added complexity associated with any kind of change that's going to be made to the ACA going forward, right? And then again, Washington, D.C., another jurisdiction that implemented additional requirements associated with the ACA. And so again, most of these requirements, especially the ones that were in reaction to Trump's first term, definitely mirrored the federal requirements. They allowed the use of a lot of the same forms. It focused on the same data. But again, it just created an extra layer of compliance requirements for individuals associated with the ACA. Again, Rhode Island was the fourth state that did this in reaction to the Trump's first presidency when he zeroed out the individual mandate. Again, added complexity associated with repealing, or not even repealing, but just zeroing out a portion of the individual mandate for the first Trump presidency. The final state that we talk about, and this is kind of the outlier, Massachusetts requirements actually predated the ACA, so this has actually always been in place, or not always. This was in place several years prior to the ACA and has continued to exist for Massachusetts employers. So we included the slide here just in case you're in Massachusetts as a friendly reminder of your own state level requirements. These are different. You know, the other four states mirror the ACA in exactly what they're requiring. Massachusetts requirement, because it predates the ACA, is actually relatively different than the other requirements. And we normally get to the questions at the end, but I actually want to address one of the questions that just showed up in the inbox right now, just to sort of making it clear. The purpose of this webinar is not to be pro-Trump or anti-Trump. It's really just to point out what has happened in the ACA in the past and what we think might happen to the ACA and the employer mandate or any other compliance requirements associated with in the future. So this isn't meant to be political in the sense of being pro or anti anything, but rather giving people an opportunity to think about what could or could not happen with a second Trump term as it's associated with their current compliance requirements under the ACA. So navigating ACA compliance as we move forward into the future, right? So as I think both Nasser and I have made clear over the first, half of this presentation, that we really don't think under a second Trump administration that there's going to be significant changes to the reporting requirements under the ACA. As Nasser mentioned, there might be a rollback of some of the things that Biden implemented during his term, right? For example, there might be a reintroduction of some of those kind of junk healthcare plans, if you want. There might be a rollback on advertising of the ACA. All of this could potentially be a minor reduction in the number of individuals that are enrolled in the exchange. But remember, under Trump's first term, the reduction in enrollment was around 10% of overall enrollees. I think it went from 11 or 12 something million enrollees to 11 something million enrollees. Now we're at 45 million enrollees. So even if we experience a 10% reduction of enrollees over a second Trump term, that's still 40 million people that are going to be on the exchange. So it's still a very significant number of people on the exchange. I also don't anticipate, unless something changes, an attack at the employer mandate, right? So the reporting requirements that employers that have 50 or more full-time employees and or equivalents have to go through right now, I don't see that changing anytime in the next couple of years, unless we see the rhetoric coming out of the Trump administration after inauguration change, because they're definitely not talking about it right now. There's also nothing in kind of the big Republican policy documents that really addresses ACA changes. And again, as we pointed out, a lot of the benefits of the ACA are being reaped right now within Republican-controlled districts, right? So there's a potential huge backlash there if any action was taken within their own constituencies. So navigating the ACA, right? So the ACA is complex, right? And as I already mentioned, it's not the biggest issue, but it is one of the big issues, right? Is this additional state ACA reporting requirements. We've found that over 43% of the mistakes that end up happening happen in that regard. And again, we anticipate that if there is any action taken with respect to the ACA, there's probably going to be a state legislative backlash to that, which will create additional ACA reporting requirements at a state level, which might cause this issue to rise even further as far as the issues that we find. The biggest issue, and this has always been the biggest issue that we find, is employee misclassification, not putting employees in the right bucket when you're filing your forms, and therefore creating potential penalty risk for an employer that's really unnecessary, or not identifying a penalty risk that's actually there, right? The second biggest issue, along with state filing, is determining ACA affordability, all right? We all know that there's several affordability safe harbors associated with plans offered the ACA, several of which require you to meet that 95% first. And when I say 95%, I mean offering coverage to 95% or more of your full-time employees. Employers still are having issues with making that calculation. And I think part of the problem is that the affordability percentage changes on an annual basis, right? So a plan that was affordable the prior year might not be affordable the next year, right? And so determining that affordability is really important for employers, and is where we see a lot of the issues, right? And then improper 1095-C coding. I know we have a question about PTCs and 226J letters that I'll address later, but I can tell you that one of the biggest issues that we find when bringing in new clients, especially new clients that come to us with an open 226J with the IRS, is that we fix their coding, and we often either dramatically reduce or eliminate the penalty simply by fixing the coding on their 1095Cs, right? Measurement methods, especially for variable hour employers, is a huge issue, right? Of whether or not they're applying the right measurement method, and whether or not they're, even if they think they're applying the right measurement method, whether or not they're tracking it accurately. And then kind of tied to that is applying the rule of parity, which is this archaic rule associated, and again, it affects variable hour seasonal employers the most, because it relates to having somebody employed, then letting them go and then bringing them back, and whether or not you have to treat their original start date as their start date with respect to their offer of coverage, right? Again, a lot of this complexity associated with measurement method and applying the rule of parity really applies to a lot of you variable hour employers in the construction industry, in the temp industry, in the restaurant industry, and a lot of these industries where you have people who come and go, and or work inconsistent hours on a monthly basis, right? We're experiencing this less and less. Dirty data was a big problem for us, in 2015 through 2019. Payroll systems have been getting better as far as the data that they provide. And so this is less of an issue for us right now. And then at the bottom of the bucket here, claiming limited non-assessment periods. And again, this kind of gets back to improper 1095C coding and determination of employee classifications, is that overall, we're still seeing that employers are not necessarily utilizing the tools available to them within the ACA to minimize their exposure risk associated with their penalty counts. All right. And this is just a kind of an overview of what we see in the marketplace as far as how individual employers are complying with the ACA. Most employers appear to be complying to it with within their payroll system, right? So payroll providers have stepped in. A smaller percentage are complying with in-house solutions, even less with a solution like us, Trusaic, outsourcing your ACA compliance. Smaller outsourced to insurance or accountants, and then some others. One of the things, and I think this is one of the challenges that, it kind of goes back to our prior slide. One of the challenges with payroll providers is that I think of them as a very skinny ACA solution. Their solution often doesn't help with things like employee misclassification, being able to determine affordability, and also making sure that coding issues are correct, right? Often it's just requiring you to input information, and it doesn't do a kind of compliance assessment on it to make sure that you're actually doing it correctly and or minimizing your penalty exposure associated with it. And I would be remiss if I didn't point out the fact that we do ACA compliance work here in-house at Trusaic, that we think our approach and our solution is very good associated with it. For any employers that would be interested in it, please reach out to us after this. I would like to get to a few of the questions that we have, some of which I think are actually going to take me a little bit of time to address. This first one, so I answered the one regarding whether or not this is an anti-Trump webinar or not. Again, we're not trying to be political here. We're just trying to anticipate what are going to be the compliance risks or non-risks associated with a second Trump presidency. Any kind of commentary regarding good or bad healthcare plans and or changes is just associated with the fact of what has or has not happened under a first Trump presidency and or under a Biden presidency, and it's not really intended to be political on our end. The next question that I'd like to address, sorry, I can't see the scroll down. Discussion. So first question, health systems frequently would use bad debt uninsured as a reason for rapidly rising health costs for employers and the overall commercial market. With the uninsured rates coming down since the ACA is enacted, we have not seen healthcare trends stabilize. If anything, it has accelerated post-pandemic. Does either political party have a strategy for lowering the cost burden on employers and the people they insure? Thanks. That's a really big question. I don't know if either party really has a good plan for this. I'm sure Democrats would say, or some portion of the Democratic Party would say, their solution is universal health care, right, to bring down healthcare costs across. I know that the ACA was intended to bring down rising healthcare costs. So the idea behind it being that the more people who are insured should lower the insurance costs for everybody across the board, because more individuals or hospital systems or healthcare networks are dealing with fewer uninsured people and therefore dealing with fewer costs that need to be passed on to the insured. I agree with you, even anecdotally, as an employer here, we see our own employees' healthcare costs go up dramatically year over year. And that has continued to occur throughout the entirety of the ACA. I also have seen it accelerate during the pandemic. As far as strategies that will actually work to lower healthcare costs, I have not seen one proposed by either party at this point in time. I'm not saying that either party doesn't have one, but I'm not seeing one that has been proposed by either party that is necessarily going to stabilize and or lower healthcare costs across the board. I mean, Nasser, have you seen anything else?
No, that's about right. And yeah, that's been the $1 trillion question, right? Is the effective way to get it done? No, it's a great question, and definitely employers definitely feel that pain too in terms of the rising healthcare costs.
Yeah. Next question was, what do you think will happen with the IRS 226J letters being issued if the subsidies expire in 2025, since those are triggered by an employees that get a PTC? This is a good question. I'm going to give a little context for anybody on the line that doesn't understand how this works. So a letter 226J is a letter issued by the IRS to an employer who complied with their employer mandate of reporting coverage, right? So they've submitted their forms, and the IRS is essentially coming back to them and saying, hey, you either didn't offer coverage to 95% or more of your full-time employees, and one of them triggered a PTC, or you offered minimum essential coverage that met minimum value, but it wasn't affordable. And an employee triggered a PTC. And you only get this letter if an employee triggers a PTC. Essentially, you could offer zero coverage. You could have 150 employees, you could file with the IRS, you could offer zero coverage. And if none of your employees gets a PTC, you will never get this letter, right? So it is a letter that is only triggered when an employee gets a PTC, and a PTC is a premium tax credit, right? And as Nasser explained earlier in the presentation, one of the things that did happen during, within, I believe it was the Inflation Reduction Act or one of those pandemic level legislation, is that there was an increase in subsidies, and also thresholds that allowed individuals to get PTCs, premium tax credits. So the answer to this question is I don't know for certain, but I assume that if that is allowed to expire, there will be a minor reduction in the number of PTCs that are triggered under the healthcare exchanges in 2025 or 2026. What employers need to realize, though, is that this is kind of a, yes, there's a slightly lower percentage chance that one of your employees gets a PTC and therefore is able to trigger a 226J letter to you. The best way to make sure you never get a 226J letter, though, is to offer coverage to 95% or more of your full-time employees, and make sure that that coverage is affordable under the Affordable Care Act. Because that's really the only way you can guarantee that you won't get a 226J letter. And what's important to note here is that one employee getting a PTC for an employer that doesn't offer coverage to 95% or more of their full-time employees can trigger that A penalty, which is based upon your full-time employee count and can be massive. We've seen A penalties for new employers coming to us to do their work in the low millions of dollars. We're often able to get those reduced. We're often able to get those sometimes erased, but that is a significant penalty exposure that an employer is looking at, right? The less risky, if you will, is making sure that you're offering coverage. If it's not affordable, right, you're only triggering a B penalty, which is based upon the actual number of individuals who got the PTC that are triggering that penalty. That's still risky, because we've seen individuals come in who met the 95% and they show us their 226J letter and they're triggering hundreds of thousands of dollars in penalties associated with having unaffordable coverage. So again, the best way to minimize this, PTCs have been on the rise, and there's a huge number of them out there. And again, even if the subsidies go down and advertising goes down, so the number of people on the exchange shrinks slightly, we still think there are going to be a massive number of PTCs that are granted on an annual basis. So I still think this is going to be a big compliance risk for employers. We're definitely not going to be going back to the numbers that we saw early on in the ACA in, say, 2016 or 2017 regarding the PTC numbers. Okay, next question was, for state reporting, do the plans have to be written in California? So obviously you have to, I'm not sure if I fully understand this question, but if you're a California employer, right, you need to offer California compliant healthcare coverage, but that's not necessarily relevant for federal reporting. That has to do with state requirements, and I won't necessarily speak to state insurance requirements. But the healthcare coverage plan does have to comply with California law. But that's kind of a separate issue from whether or not it meets minimal essential coverage at minimum value and is affordable under the ACA. I think that is the last question that we had. So I think we'll wrap it up here with essentially saying that, I do anticipate some sort of negative trend as far as enrollment in the healthcare exchanges especially for the first 2 years of a Trump administration, as I anticipate him rolling back any changes that were made by Biden, especially through executive order, that potentially increased enrollment in the exchanges. I also anticipate them looking to decrease federal spending, and therefore advertising, especially for the federal exchange, is likely to decrease. So we're going to see probably a slowdown in enrollment slightly. We'll see a slowdown. I anticipate them letting the subsidies expire. But at the end of the day, I don't anticipate them doing anything to the core pieces of the ACA, right? It's too entrenched at this point in time for them to realistically pull back healthcare coverage for 45 million Americans, especially when a majority of those Americans likely reside in Republican-controlled congressional districts, right? The ACA is immensely popular. It accounts for a significant amount of the country's GDP. And also, the caveat here, too, is that if for some reason they did do something structural to the ACA, there is likely to be a state backlash to that all that's going to do is increase complexity for employers that are trying to comply with their reporting requirements. Anything you want to add on there in the conclusion, Nasser?
No, thanks for bringing it home, Maxfield. Yeah, it's reiterating what we've talked about before, that this is definitely a different Trump administration too, in terms of his stated goal of repealing the ACA outright. So, and we saw what happened during the Trump administration this last time. That wasn't able to happen. So, it would be difficult to imagine a world where the ACA is repealed outright or significantly curtailed. So we obviously, at the end of the day, this is speculating to some degree and predicting based on all the previous data we have, but it would be very unlikely, I think, based on the previous data we have. And again, even if it does happen on a state level, it would become even more complicated.
Yeah. Okay, well, thank you very much, everybody who attended today. If there are any questions that come up after the presentation for anyone, as far as what you think is going to happen with individual pieces of the ACA, and or questions regarding what kind of statewide compliance challenges might happen in the future, please feel free to reach out to us, either email me or Nusser. Our contact info is here as far as our email addresses. We're happy to answer any questions after the presentation.